Hey, Dr. Dennis, I'm helping my mom out, and I've got a few questions about her dentures. Uh, how long does it take to make a set of dentures?
How long does it take to make a set of dentures? That is going to depend on what we are trying to accomplish. Most people that I make dentures for already wear dentures. And if you're already wearing dentures, they loose, they're falling out. You've had them for 20 years, which I see very often. We really take our time making a good denture. I usually can make a very fabulous upper denture in about 3 or 4 visits. And those visits are usually spaced about 1 week apart. Now, when I make those dentures, of course, you have your own dentures to wear in the meantime, so there's less of a hurry in order to do a really fast denture. I always say the slower time we take on the front end, the less adjustments, the less things we have to do on the back end. So I like to take my time. We do multiple try-ins. You get a chance to actually see what the teeth are going to look like, choose the color, the shape, everything you like. If you don't like it, we send it back. We make any modifications that you need. So those visits, like I said, are about 3 or 4 visits spaced out, including the adjustment visits. That means you've worn it at home for a couple weeks or days, and then any sore spots will just kind of take away. So that's about how long it takes to make a denture. Now, however, there are times when I have someone who has a few teeth missing and they're unwilling to be without some teeth while we're making their denture, and that's completely reasonable. I wouldn't want to walk around without any teeth either. So I understand that. Now, in those cases, we can do what we call an immediate denture. And an immediate denture means the day that we pull out your remaining teeth, you will get a denture right away. We will make the molds, then we set the appointment for the extractions to pull the teeth, and on the day that the teeth are pulled, we take the teeth out and in goes your denture that same day. Now, because you're having teeth pulled, there's going to be some changes that need to be made later. That means over the next couple months, as your gums change because your teeth are no longer there and the swelling reduces, we may have to reline the denture, worst case, remake the denture. But that is a pretty quick turnaround, but it just depends on the situation of what your starting point is.
She is always complaining about them coming out and feeling uncomfortable. How can you get her dentures, to stop moving?
When we make dentures, the upper denture tends to be a pretty stable denture. The bone on the upper is very stable. It doesn't shrink as fast as the bottom. And it also has the palate. So the roof of your mouth, which is your palate, creates a suction that holds the denture into place. So I usually do not get a lot of complaints about their upper denture. Now the lower denture, most people do not like. And dental implants were invented for that reason, to stabilize your lower denture. Now, I am a huge fan of lower denture and implants. I almost won't do a lower denture without explaining the benefits of an implant. And if people choose not to do it, they already realize, oh, I don't know what's going to turn out, especially if they've worn a denture for many years. Over time, and we have other videos about this, over time the bone on the bottom shrinks so little that there's nothing that holds the denture in place. Not only is there nothing that holds the denture in place, but what also happens is your tongue is constantly dislodging the denture. So the tongue goes up and it pushes the denture out. And that leads to a lot of very embarrassing moments. Now, it also leads to a lot of discomfort. So can you imagine if something's always moving around in your mouth, it's going to hit a lot of different spots and it doesn't feel good. So dental implants, sometimes we place 2. Denture snaps into place over that. Doesn't move, no glue required. Sometimes we place 3. Just for balance. Sometimes we'll place 4. It just depends. Or sometimes we place minis, which are really awesome for very thin bone, very non-invasive. Again, I have other videos that talk about and show you exactly what minis or implants that hold in a denture looks like, but it's probably one of the best life-changing things that you can do is add implants to your denture.
Uh, why does the bottom denture move more than the top one does?
Again, as far as the bone is concerned on the bottom, it tends to shrink a lot faster, gets narrow, gets thin, and also it has the tongue as pulling everything out of the area. So that causes more movement of that bottom denture. And then on the top, which I didn't mention before, you have the palate. However, I do have people who cannot tolerate having the roof of their mouth covered. So if you can imagine, if the roof of your mouth is covered, you do not taste food the same. I mean, you'd be surprised at how much that tasting food goes with the roof of your mouth. So you don't taste food the same. And some people with a very strong gag reflex cannot tolerate it. So again, that's where dental implants come into place. They eliminate the need for the palate. So you could just have implants snapping your denture into place. And then on the bottom, it's the same thing. It keeps, even though that bone is shrinking, and the body is going to react to the fact that there is no tooth. When there are teeth, the body keeps the bone. But when there are not any teeth, then the body says, I don't need that, and the bone starts to shrink. Dental implants actually trick the body into thinking that there's still teeth there, so the bone stays. So over time, you'll maintain more bone by having dental implants in place.
And can you tell me how implants are able to help with dentures?
Implants help with dentures by creating almost like a male and a female part that connects. So if you think about it, and again, we have it on other videos, if you have some implants and they're sticking out of the gum, then the denture on the inside of the denture will have a circular portion that snaps onto that. So that would be the female and that would be the male, right? So then now you have that situation where you snap right into place and it stabilizes it. It basically opens up so many things that if you were not able to eat before, now you can eat. Now you can eat with confidence in public. You're not afraid that your dentures are going to fall out into your cup or onto your plate in front of your grandchildren or in front of your friends and family. Or you can also speak with confidence. Again, you're not afraid it's going to come out. So it completely changes the way you see your dentures.
Well, does she have any other options?
I have met people who have dentures for many years or partials and just have a few teeth left. And the idea of doing a denture, I mean, everybody thinks that only older people need dentures, but there are people who are younger who unfortunately, for whatever reason, over time, accidents, periodontal disease, lots of cavities, and pulled teeth at early ages, that have lost their teeth, and maybe they're not very excited about getting a denture. I wouldn't be either. However, there are other options, and the other options are what we call fixed options. So even though you have dental implants with your denture, you're still going to take it off, you know, put it to bed at night and that sort of thing, which is an upgrade from having just a regular denture. Now, an upgrade from that is what we call a fixed option, which means that instead of having a denture attached to your implants, you have crowns, you have teeth attached to your implants. And guess what? You don't take those off. There is nothing covering the roof of your mouth. There is no acrylic piece that goes onto your gum to create suction. There is nothing to flip out with your tongue. That is as close as you are going to get to the younger days when you had all of your teeth before anything was pulled. Now, we think of those in a little different in that 2 is not going to be enough anymore. And what I typically like to do is something called all-on-6. There also exists something called all-on-4, which we can discuss in other videos, which is less implants. To me, a lot less stable, but all-on-6. All-on-6, strategically placing 6 implants, top or bottom, and then we take molds for crowns and bridges. And again, man, it's a huge difference. You basically take that denture and throw it in the trash because that's the end of that. You will never have to remove something again. I mean, I can take it off if we absolutely have to, but there's nothing to remove in that case, and you're basically done with dentures. I think that's a great option with somebody who's been struggling with their denture a long time, are tired of all the things associated with dentures, and just want to feel like they have regular teeth again.
Thanks a lot, Dr. Dennis.